Hello, my name is Marlene and I'm a student nurse. So I have a patient who has a tracheostomy today, and I noted that he had visible secretions, so I'm going to be performing suctioning and trach care. Alright, so first we're gonna go in, knock knock, provide privacy, introduce myself. Hi, my name is Marlene and I'm a student nurse. I'm hand hygiene. So what I'm here to do is I'm noting that you have visible secretions, and I'm going to be performing suctioning on that. Can I get your name, your date of birth? Okay. Mr. George Patel. Oh, are you having any pain right now, from 0 being no pain to 10 being the worst pain ever? No pain, I'm glad to hear. And I have already obtained his vital signs. So like I mentioned earlier, I noticed that you have visible secretions. Are you able to clear secretions on your own? You are not? Okay, that's fine. That's why we're gonna perform suctioning to get rid of those secretions, okay? Alrighty. So now there is extra equipment if needed, and I'm going to raise the head of the bed. And I'm also going to raise the bed itself to a comfortable position. Now I'm going to make sure that the neck and the head are supported, and you are comfortable, Mr. Patel. Yes? Okay. Alrighty, so now I'm just gonna go ahead and put on some gloves. And I'm going to assess those lung sounds, okay? So let's go ahead and clean my stethoscope. All right. Clean the stethoscope. All right. Clean the stethoscope. All right. Let's go ahead and assess the lung sounds. Go ahead and try to take a deep breath for me. Okay. Again, please. Again. And again. All right, so I do notice some crackles there. Let's place a pulse oximeter on you to check how that oxygen is looking. All right. So it looks like it's at about 90, 93, 94. Let's perform some oral suctioning before suctioning your tracheostomy. So I'm gonna connect the yonker to the suctioning, making sure that it turns on between -80 and -120. All right, let's perform some oral suctioning. Going to the sides. All right, and I'm gonna go ahead and clean it with saline. Get rid of those secretions. All right, I'm gonna turn it off now and just place the yonker near within your reach, so you're able to also get rid of those secretions and suction your mouth. All right, I'm gonna remove my gloves and perform hand hygiene. Okay. I'm observing the oxygen after I perform suctioning from the mouth, and I'm noticing that it's still low, 94, so I'm definitely going to be suctioning the inner cannula. So I'm going to make sure that my table is clean and disinfected, and I'm going to place my sterile objects. So what I'm going to be using today is going to be a 14 French sleeved catheter to suction the inner cannula. And I am not going to be using sterile gloves. I'm just going to be using regular gloves for this procedure. Let's go ahead and make sure that I have my saline. All right. And like I said, it's disinfected. I'm going to open my catheter. All right. If you can see that. All right, so I'm just gonna go ahead and make sure that this is loose so that I can use it. Now I'm gonna grab the saline box to place saline in there, and I'm going to put on some gloves. Okay. And I performed hand hygiene before this. All right, so I'm going to make sure that I grab my catheter, my sleeved catheter, 14 French, without contaminating. So as you can tell, it's sleeved. So I'm just gonna use this part to put it with the suctioning. It's connected to the suctioning, okay, making sure that it's between -80 and 120, like I said earlier, making sure it works, okay. And I'm going to put the sleeve down gently without contaminating and put the tip inside the inner cannula. And I'm going to go down until there is resistance or the patient starts coughing. And once that happens, I'm going to withdraw it 1 centimeter and then begin to intermittently suction gently, possibly in a circular motion, gently, making sure that I don't do this for more than 10 seconds. Okay, so intermittently, like I said. And then I'm going to clean I'm just gonna insert the tip of the catheter inside of the saline and suction to make sure that it's clean from the secretions. And I'm waiting about 30 to 60 seconds to assess the patient and make sure that the patient is doing okay. The saturation looks good, okay. Looks a little bit better, 96, it's going up, 96, 97. All right, and now that I noted that the patient doesn't need any further suctioning, I'm going to get rid of this and I'm going to assess the patient's lung sounds. So, and noting that the airway is clear from secretions. So I'm going to clean my catheter. My stethoscope, disinfect it. Okay. Take a deep breath. Okay, another one. Okay. Alrighty. And just going to perform hand hygiene once again. Alright. And per facility protocol, I'm going to go ahead and change the inner cannula and replace it with a new one. So let's go ahead and get my stuff. Okay. So are you feeling okay, Mr. Patel? Are you having any pain from 0 being no pain and 10 being the worst pain ever? No? Okay, sounds good. So it seems like the patient tolerated the suctioning okay. So I'm going to put on some gloves to get rid of the old dressing and assess the old dressing. And prior to doing the suctioning, I would have placed a towel over the patient's chest, which I'm going to do now. Okay, so let's go ahead and grab that dressing. And I'm going to assess for coca. Once I've done that, I'm going to encase it in the glove and get rid of it. Okay, throw it away. Perform hand hygiene. Alright. So, like I said before, we're going to go ahead and replace the inner cannula. So we're going to go ahead and put in a new one. So prior to removing the inner cannula, I want to make sure that the inner cannula is not metal, because therefore I will make sure not to use hydrogen peroxide. So I'm going to make sure that my bedside table is disinfected so I can place my sterile items. So what I'm going to place on that table is going to be inner cannula kit, my sterile gloves, my tracheostomy kit, and my sterile saline. So make sure that it's a little bit loose, my sterile saline. Okay, and I'm going to perform hand hygiene once again. Alright, so I'm going to start opening my items. So I'm going to open my tracheostomy kit. So I don't know if you're able to see this. Okay, that's better. Okay, so that's that. And I'm going to open my inner cannula. it right there. Now I'm going to go ahead and open my sterile gloves. See it? This doesn't matter. So make sure that I don't overshadow that. Throw this away. Open my gloves. Let me see it. Can't see it. Alright, want to see that? Okay. Alright, so I'm gonna put on my sterile glove, my dominant hand. Okay, now I'm gonna go ahead and grab my sterile items and place it on right here. That's my sterile field. I have a new dressing right here. I'm going to place some dry gauze. Some dry gauze right there in my sterile field. And now I'm going to my clean hand. I'm going to place some saline, sterile saline. Okay. Now I can go ahead and put on the other glove. That's okay, I can always fix it now that I have my other hand. But actually this is going to be clean and this is going to be sterile. So now, with my clean hand, I'm going to grab the old inner cannula. And throw it away. And then with my sterile hand, I'm going to put in the new inner cannula. Sterile. And put it in. Alright, now I'm going to grab some 4x4, some wet 4x4, squeeze out the excess and clean around the stoma. Get rid of that. Gonna grab some 4x4 dry and clean around dry the stoma. And if needed, I would have used Q-tips to get rid of the old debris, to soften it and get rid of it. So I'm gonna get rid of that. All right, and now I don't need to be sterile. I'm just gonna go ahead and put on the new dressing. Okay, I'm assessing the ties if they need to be replaced, but just by assessing them, they look pretty clean. But I'm just gonna make sure that 2 fingers fit between the neck and the ties. Definitely, it's okay. So I'm just going to go ahead and check the oxygen saturation. I see that the patient is at 98, so that's his baseline. He's tolerating the procedure well. How are you doing, Mr. Patel? Are you doing okay? All right. So now I'm just gonna go ahead and get rid of this. And if the patient needed any oxygen or humidification, I would have put it on the patient. So get rid of my trash. Alright. Put on some, go ahead and wash my hands. Wash my hands. Now that the patient is doing okay, get rid of this towel. Clean my hands again. Looking at the patient's oxygen, looks good. Okay, so I'm going to do my final 4, which is lower the bed. I will make sure that the call light is within reach. Is there anything else I can do for you, Mr. Patel? And if there isn't, then I will just go ahead and wash my hands. So the things I would document would be the patient's lung sounds before and after. I would go ahead and document the coca of the secretions, the coca of the dressing. I would document the oxygen saturation before and during and after the procedure. And I would also document how well the patient tolerated the procedure. And that is it.